Next bill is, Delegate Samirah asked me, I'm such a softy, but he wants to take up his bill now because some of his witnesses might leave. And so, Delegate Samirah, can you go ahead and present your bill? And the number on that bill is what now? It is 5083. We got to do this quickly, okay?
Sure, I have prepared remarks, and I'll hopefully.
Okay.
And yes.
Yeah. Please proceed. This is the public option bill.
This is the public option bill, yes, sir. Members of the committee, Mr. Chairman, months before the COVID-19 pandemic and the movement for Black Lives took off, I introduced legislation that would move us towards greater public health preparedness through universal health care. It was HB 530 of the 2020 session, and it would have provided cost-saving Medicaid buy-in plans, more properly known as public option, funded at the primary expense of our most benefited actors in our healthcare system. You will hear much of that in testimony today. It is a common sense measure, the crux of then President Obama and then Vice President Biden's original Affordable Care Act proposal. And that was January 31st when I put it in committee, and it got quickly stalled in Labor and Commerce with many committee members not in attendance. The public option bill did not even receive a vote, effectively silencing a lot of the expertise of healthcare and the voices of our...
Delegate Samirah, the bill was carried over to 2021 by the Labor and Commerce Committee, HB 530.
Sure. Thanks for clarifying. Effectively silenced is what I said. That our constituents are suffering disproportionately under our current system. Today, having utilized much healthcare economic expertise of our healthcare think tanks and institutions, as well as my own as a healthcare professional, I finally get a chance to stand up for those on the margins and speak out against the public health theft perpetrated. Virginians should be able to afford to be healthy during this pandemic. And in the absence of immediate action from the federal government, it is our duty as state legislators to push us closer to quality, affordable, and universal health care through the immediate passage of a public option into law. I want to take a moment to explain why I have reached the conclusion that this immediate action is absolutely necessary. I was elected to give back to the people of Herndon, Reston, Chantilly, and Sterling by helping families most marginalized by our public health systems. I was not well known in my community. My constituents trust me not only because I have public health expertise, but also because I have worked relentlessly to overcome heavy discrimination, both in my personal life and as a doctor working in a disadvantaged community. Most importantly, my people saw me as someone that cared about them, given that I'm not a career politician. On March 9th, I stood up and made the last speech of the 2020 regular session. I asked the Honorable Governor Northam to convene a special session to address the impending public health and economic crisis. I knew hundreds of thousands of Virginians would soon be without employer-provided insurance, facing economic ruin, and would be left to confront the virus unaided. I specifically highlighted how Black, brown, and low-income individuals would carry the largest burden if we did not act. I was booed by some of our colleagues while speaking up for all of our constituents. A special session to immediately address healthcare affordability through a public option was not immediately granted. Much needed healthcare reform was delayed by colleagues of ours once again. In the time since, many Virginians have lost their jobs, lost their loved ones, and they have taken to the streets to demand reform to a system that has ignored their cries for help. Citizens of the Commonwealth are facing financial ruin, attempting to get the care they need, all while private companies are lining their wallets with the misery of our constituents. The public option legislation that I want to introduce for a floor vote today for immediate passage is a truly affordable insurance coverage plan for any Virginian that can pay Medicare rates. It will be one of the first steps towards a universal healthcare system that delivers care based on the principle that healthcare is a human right, and it won't cost the Commonwealth of Virginia's taxpayers a single penny. Even though I was booed by some of our colleagues for asking to convene a special session, we are now in that session, and I am proud of the role that I played in making this a reality. I come back to you now more determined than I was on the last day of regular session. The district I represent has 2 of the top 10 highest coronavirus-infected zip codes in the entire Commonwealth. In the absence of immediate federal action, millions of working-class brown and Black families in Virginia cannot afford to be healthy. They expect us, their state legislature, line of defense, to provide relief. They expect us in this historic moment to act without any delays. And they expect us to put their interests ahead of private companies that have doubled their profits amidst a global pandemic. It is our duty as state legislators to answer their calls for relief by immediately passing the public option to law. Mr. Chairman and my colleagues, while Medicaid expansion has been a crucial healthcare relief for those families making under 138% of the income federal poverty line, there are still close to over 250,000 Virginians who fall into the coverage gap between qualifying for Medicaid or Medicare and having private insurance. Just think about how many lives that is for a second. Millions more Virginians are paying too much for their healthcare coverage, and both numbers are rising. As proof of this healthcare crisis, last year, the Kaiser Foundation found that 25% of all Virginians said they or a family member had to skip out on serious medical care because they couldn't afford it. That's over 2 million Virginians. We all know someone who has not gotten much needed care because it was too expensive to get. This was before the economic crisis caused by COVID-19 and the pandemic hit. Roughly 200,000 Virginians have lost their employer-based health insurance, leaving them without coverage in the midst of a crisis. These Virginians come from disproportionately low-income backgrounds and also are disproportionately Black and brown. Some of these families will qualify for new plans under Medicaid, but too many won't. These families will struggle to find affordable options despite the best efforts of the Affordable Care Act. And if they are given a COVID diagnosis, will have to make the choice between not getting full health care and risking death, or getting full health care and getting financial ruin.
You need to sum up, Delegate Samirah. You need to sum up. We got witnesses that are going to speak, okay?
I understand. Thank you, Mr. Chairman.
Okay. Thank you.
I'm sorry. I'm barely halfway through, sir. And I really want to complete
No,
this.
You got to be kidding me. Well, I think we understand where you're going with this.
I didn't finish. I really would like to finish and get more time than talking about hydroxychloroquine, Mr. Chairman.
We didn't talk about hydroxychloroquine.
We had a bill on it.
You're getting a lot. You got a lot more time.
Okay. Some of these families will qualify for new plans under Medicaid, as we were saying, and there's a coverage gap. One health analytics organization estimates that the typical cost of a COVID hospitalization is $23,500, while another estimates that a cost for a 6-day stay with complications averages $74,000. On top of all of this, we just had over 300,000 Virginians that were uninsured from last year before the pandemic hit, according to the Virginia Healthcare Foundation. So just doing some simple math, that's roughly 500,000 Virginians without health insurance at the moment, overlapping with over 2 million Virginians that cannot afford health care with or without health insurance. Take a second to think about how many of these millions that don't have the money to get health care, add in their likelihood of getting a COVID-19 infection, given their disadvantaged status. And remember that the infection rate will rise even more as we get to colder times of this year and next. How many will die if we don't confront the and under affordability problem in the face of getting quality care? Are we able to feel this massive human pain? This high cost has led to billions made by private insurances on the backs of our citizens.
We got other bills after you.
Yes, sir. This is a very big deal for millions of Virginians. We're talking about a lot of people, sir. When over 177,000 dead Americans result in insurance companies doubling their profits, let me repeat that. It is a sad and strange reality when over 177,000 Americans being killed due to COVID-19 results in insurance companies doubling their profits. This dissonance between the for-profit system and the public health reality on the ground speaks to how broken our system is. It's just another symptom of this disease I speak of, and it certainly can't be treated with more private industry solutions. The lack of affordability issue is clearly forcing itself to levels of public pain we have never seen before. These numbers may seem concerning by themselves, but I urge my colleagues to remember that behind each number is a human story. A story like the one of my constituent, Courtney, who had a perforated colon, but her insurance refused to pay for a CT scan. She was forced to drive herself to the hospital and wait 2 hours only to find out that she was in dire condition. On top of this dangerous ordeal, her stay at the hospital stuck her with over $1,000 in out-of-pocket expenses. Or my constituent, Kathy, who was told by her insurance company that her son would have to wait weeks for a necessary nose and sinus repair surgery. Meanwhile...
Delegate Samirah, we've got to stop.
Sir, I need to speak up for my constituents.
Everybody, you're spoken up really well.
I really need to finish this.
We have to move on.
I'm working on this, and I need to be able to express my full position on this.
You want people to speak in the public or not?
Excuse me?
You want people to speak from the public, or are you just going to keep doing this?
No, I absolutely will, and you will hear from them, and they will be passionate. This is very important. This is unacceptable for Courtney and Kathy, as well as for all Virginians, especially when they are skipping out on treatment due to fears of high costs in the midst of a global pandemic. While I have not had as much time in the legislature, as a medical practitioner working in the economically disadvantaged Shenandoah Valley, I've seen firsthand how many Virginians are skipping out on treatment every single day because of the large price tag. The unaffordability of healthcare in the Commonwealth harms too many Virginians, and in the absence of immediate federal action, millions of working class brown and black families in Virginia cannot afford to be healthy. They expect us, their state legislator line of defense, to provide relief. They expect us in this historic moment to act without any delays. They expect us to put their interests ahead of private insurance companies that have doubled their profits amidst a global pandemic. It is our duty as state legislators to answer their calls for relief by immediately passing a public option legislation into law. Okay. There's two quick reasons I need to go over why a public option is really... No.
Okay, that's it. You passed your time. You talked longer than any other delegate today.
Sir,
is there anybody from the public who'd like to speak to this bill?
There's two quick points I need to make on why we need a public option.
Mr. Chairman?
Yeah, Delegate Hodges.
Thank you, Mr. Chairman. Before we move forward, and I hate to interrupt the patron, but before we move forward, can I ask that the chairman rule on the germaneness of House Bill 5083, or whether or not it's germane under the rules of this special session?
Mr. Chairman, I need to finish what I was saying. This is a cutting in the middle of a testimony. I haven't even provided the two main reasons why we need to pass a public option. Very simply put, it would provide these cost-saving plans without the need to raise taxes. And number two, it would be very affordable for people of all backgrounds in Virginia. Look, if you guys don't want me to continue this testimony, I mean,
I think we understand it. Understand.
No, I haven't. There's so many points that I have to make about this very big important topic that we're not addressing right now, sir.
Okay, we're good. All right. Really big subject, special session, recurring cost to this. It has a $500,000 fist to it. We don't have money to pay for anything that's got a recurring cost to it, for starters. And I want to hear from the public, okay?
Mr. Chairman, there's no fist to this because hopefully we have the DMAS.
All right, we're going to mute you if you don't stop. Okay. Does anyone from the public want to speak to this? We've got Julie Don, Doug Gray, and Luis Aguilar in the room now that are either for or against this bill. And we don't look. We're at this 2 hours now. Anybody want to speak up?
I'd be happy to speak first if that'd be okay, Mr. Chairman.
And can you identify yourself?